my name is Laura and I'm one of the Haematology nurses from the NHS, and I've been working on the field for about 4 years. Today I will be talking about what is an hematology nurse, and more specific, what is an Haematology nurse and what do we do. Hematology is the branch of medicine where we look after and investigate conditions that are associated with blood problems and also bone marrow problems, which is the factory where all the blood cells are made. We look after as well people with red cell disorders, which are usually inherited conditions like sickle cell disease or thalassemia. There are many types of blood cancer, and the three main cancerous hematological disorders that we treat are leukemia, lymphoma, and myeloma. Haematology nurses, we work in many different areas. We can work in the hospital, in the outpatient setting, in the community setting, in acute and palliative care, also in radiotherapy or chemotherapy wards or medical wards. Lots of our patients are treated in the outpatient setting or the day unit, or even with tablet-based treatment that they might just take at home. But some of our patients, of course, do need more intensive treatment, for which there will be an inpatient on one of the wards. That is what I've been working and in what this video is based. The treatments that we use as an inpatient are generally slightly stronger, more complicated treatments, maybe chemotherapy treatments that are more likely to have side effects. So the patients might need additional support and things that we can safely do in the community setting. But how you can be an hematology nurse and get into this world? Well, you just have to apply as to any other specialty. And don't be scared if you feel that you don't have enough knowledge. We all have been there, trust me. Most of the hospitals in the UK have a special training program for new Band 5 hematology nurses. In this process, nurses learn about putting evidence into practice and how to provide both curative and palliative treatments for all types of cancer and blood disorders. As the nurses, we are responsible for quickly assessing and provide appropriate interventions. I think these introduction courses are very useful for new nurses to understand what diseases we are treating, how it progresses, and why we are giving each treatment. After this course, most of the nurses, they can feel the hungry to learn more because it's super interesting and there are many branches in hematology. When you get more experience on the ward, you can also do some chemotherapy courses. Haematology nurses, we are dedicated nurses that we understand the chemotherapy that we are giving and we understand the toxicity that it involves. The role that I think an hematology nurse stands out is clearly dedicated into bone marrow transplant roles. It's a specific role you need to support patients and families through it. Usually, once you acquire the competencies to give chemotherapy, nurses can apply for a Band 6 post and they get more involved in bone marrow transplant, which is extremely interesting topic, and you get more in touch with the team as well, which is great because we have got a big group of colleagues. That's one of the nice things about hematology as well, is that we do get to work in a really big and diverse team. In a normal hospital, you will find the consultants of each subspecialty, registrars, SHOs, advanced nurse practitioners, clinical nurse specialists, laboratory staff, psychologists, dietitians, physiotherapists, occupational health workers, and I hope I haven't left anyone. That's my sort of close working group, and I think the multidisciplinary team is really important part of the treatment plan. Let me share with you how could be a normal day. If I was on the ward, I might start in the morning by coming in, getting handover from whoever was on the previous shift, making sure there weren't any urgent issues on the ward. Then doctors tend to do a ward round, review all the inpatients and discussing the plan for the patient. A typical workday can be hectic, but it's always rewarding. Certain tasks must always be completed, like physical assessment, administering medication, bathing, toileting, and rounding with doctors. You may have a patient who is newly diagnosed with cancer, or you may have a patient that is having a sickle cell crisis, or patients that they are having their transplant day that day. So it's very varied with different patients, and each patient has different necessities that we will take care of. There's a lot of flexibility in how you can structure your work. We are very busy, but that's because we do full-time clinical job where patients can get worse very quickly. And the clue is to have very clear our task and one by one attend all of our patients. Listen to our colleagues, learn how to escalate and work as a team is key as in any other work. But to be honest, I enjoy each day I get to spend with my patients, seeing them smile or reach my hand. I always said that with such a terrible disease as cancer, I hope that one good and positive thing that could come from their stay is me, my team, and the care that we provide. So one of the great things about hematology is the long-term relationship that we have with our patients, because we can know them from sort of the beginning of their disease all the way through their entire lives. So you do really know everything about them. You know their family circumstances, what's going on in their lives. So you see them as a whole, not just a diagnosis or a patient. In my experience, what I find particularly rewarding is when you have a patient and this patient comes to the hematology outpatient division who's perhaps been really unwell on the wards and has got better and is telling you how much better they're feeling, and that's the best feeling in the world. That is why I think being an Haematology nurse, that's a great career, and I would strongly recommend it to anyone, because you can see in some patients the progress, the advance of your patient from the inpatient ward up to when they feel better. And yeah, I think that's great. Thank you for watching, and if you'd like to see more of what's going on the nurses world, you can visit Nurses.co.uk, and I hope you have a great day.